Speaking of attached patients or unattached patients, Fredericton has is the one area in the province with by far the highest number of unattached patients. And yet, in these budget estimates, there is nothing that suggests that family health teams will be stood up on the south side of Fredericton, only on the north side. And this is important because the new model is geographically based. So you have to live on the north side to be in the future attached to that clinic, and that leaves everyone on the south side who are unattached, which are many, in the cold. So why is there no plan for addressing this area on the south side of Fredericton with such a high level of people without primary care providers to give them a medical home?
Mr. Chair, to the member opposite. Firstly, thank you for your advocacy. You know, we've talked a lot about the Northside Clinic and how it will attach patients primarily from the geographic community. And as you conclude, what about the south side of Fredericton, where there's a significant number of unattached patients? It is probably one of our biggest concerns, the number of unattached patients in an urban area. So fortunately, MB Health Link has helped with a lot of Southside patients, and while it's not the same collaborative care model that we like to see moving forward, it is has helped a lot of people, particularly people with chronic diseases, and taken many people off a completely unattached list, and we are negotiating with MB Health Link to help move them to collaborative care clinics. They're very close. They have physicians, nurse practitioners, other healthcare people that assist those patients that are with them but are not attached to a traditional collaborative care team. And we are hopeful that MB Health Link will be a significant positive factor in moving MB Health Link patients to a collaborative care clinic or healthcare home in the south end of Fredericton. You are a good advocate for the needs of this community. It needs more than that. It needs government to help to recognize that and come up with strategies. That is one of our strategies. It's a significant strategy. We are also hopeful that the community itself will pull together our remaining family doctors that are there to maybe prolong their service to the community because they work together. They don't have to do individual solo clinic call. And I am hopeful that if they subscribe to this model, we could do a better job at attaching people from the south side of Fredericton. I personally wish there was more small collections of family doctors and nurse practitioners that would come to us and say, we haven't seen a lot of that yet. And so we say, well, what can we do shy of that if there's just such a deficit of family care? Let's look at people that are already looking after your patients, such as the MB Health Link, and how can we support the MB Health Link to provide the bigger part of a collaborative care team, like a physical space where you can be assigned to a healthcare practitioner, not just the Health Link team, so to speak. And they're very warm to that idea, if I could put it that way. I think they recognize that they were created in a time of despair and significant need in New Brunswick, when it was advertised by the Health Council that there was in excess of 180,000 people that were not attached. NB Health Link has gone out to attach at least 60,000 of those. And now how do we take those 60,000 and move them into the type of clinic that people would like to be part of, that has a physical space, has an attached person, either a nurse practitioner or a physician, is that their attachment point. And I'll take a little time to speak to the role of pharmacists. You know, as many of you have heard, there's been a pilot that showed the value of pharmacists to attach patients to, well, a care provider, a pharmacist, that previously did not have anybody. And so we're negotiating with our pharmacists as we speak, so that a pharmacist can be an attachment point that works with another primary caregiver is a nurse practitioner, family doctor, that might be at a stage before those two participate in a bigger collateral practice. So we're looking at, I'll say, short-term ways of getting people attached to somebody that could help renew prescriptions, assess minor medical ailments, and to a new degree look after some people with chronic diseases. So I recognize what you are reminding us of today, specifically the needs of unattached patients on the south side of the St. John River in Fredericton, and we will be making strides into that community as well. Thank you.